Hello, and welcome to the tutorial video for the patient portal for the Office of Dr. Metwally, Advanced Joint Replacement Center of Southern Oregon. This video is meant to help you complete the 6 forms required before your appointment. To begin with, check your email. You're going to see this email pop up in your inbox. Select it. You'll see this. This is Create Your Account. Select that. So here, it's going to ask you to create a password. This password has to be at least 8 characters long. It has to have at least 1 capital letter. It has to have at least 1 number. And it has to have at least 1 symbol, such as a @ sign or a pound sign. For example, you could type in password with a capital P, with the letter 1 and an @ sign. Next, go to confirm password, where you need to type it in exactly as you typed it in the first time. Password. 1 @ sign. Now it's going to ask you to put in your birth date or the last 4 digits of your social security number. You do not put in both of these things. You choose one or the other, whatever is the most convenient for you. Make sure to select that you've read and agreed the terms and conditions. If you'd like to read these, select here. Now hit register. After you have registered, your username is going to be the email that you use to sign up. This is your patient portal. Here you can view your records, pay your bill, request medication refills, request an appointment, or ask any questions. And of course, fill out your patient forms, which you will be doing now. Also, feel free to call the office with any questions that you may have. If you have not completed a form in under 10 minutes, it will ask you if you'd like to stay signed in. This is for your security purposes. If you would like to stay signed in, select yes. Now, to fill out your forms, you'll see them available here, 6 forms. Your forms must be filled out no earlier than 10 days before. When your appointment is 10 days away or sooner, you will see that these forms are available. Before that, you won't see anything here. Select Forms. These are the 6 forms that you will be completing before the date of your appointment. Start with the first form, which is HIPAA consent. If you would like a copy of our HIPAA privacy policy, you will select this top box. If you do not want a copy, you'll select this bottom box. You will then go down and type in your name. Next, you will sign. To sign, you will take your mouse and click and press down. Then you will sign your name. If it doesn't look perfect, that's all right. It's just important that the signature is there and somewhat legible. If you'd like to start over, hit clear. That's a little better. To complete the form, you go up here and finish and submit. This is our permission to release information and assignment. These are our office policies. Please read through them before you complete the form. Here you will type in your email address. After you've completed reading our office policies, you will again sign. Once again, finish and submit. This form is very important. This is the authorization to disclose your medical information to another person. Please read this carefully and only complete this form if you wish to grant someone access to your medical information and records. Due to HIPAA standards, we cannot discuss your medical information with anyone. That includes a spouse, a child, anyone, unless this form is completed and their correct information has been inputted. You are authorizing that this individual can contact our office on your behalf, either by telephone or in person, to ask about your appointments, your related medical care, and your financial issues. For example, when we call to remind you about your appointment, if this person answers the phone, you're allowing us to tell them what time your appointment is or what it's regarding. You do not have to put anyone in these boxes. If you would not like anyone to have access to your medical information, simply put none. If you do wish to add someone, You will put in their name, their date of birth, how they are related to you, and lastly, their phone number. To finalize this form, once again, sign. A signature is required for this person to be added to your account. Please rate your pain from 0 to 10. 0 is no pain, and 10 is the worst pain you've ever felt. When your pain is at its worst, how would you rate it on a scale of 0 to 10? Since your last visit, is your pain better, same, worse, or if you're a new patient, you will select not applicable. Where is your pain located? Be very specific. Please describe the pain. For example, is it sharp? Is it dull? Is it aching? Is it burning? Please describe in the most specific way possible. Where does the pain travel to? With these, you do not type anything. You hit this arrow and choose the answer that best describes what you're experiencing. If you do not feel that any of these answers correctly describe what you're experiencing, please select the best option. How severe is your knee pain? Is it mild? Is it moderate? Is it severe? Think about what you're experiencing day to day and answer the best way possible. Is your knee pain constant or intermittent? Do you experience pain all day, every day, or does it come and go, maybe with certain activities? How long have you been experiencing knee pain? Years, months, even days? It's important to let us know how long you've been going through this pain. What makes the pain worse? Walking, sitting, any sort of activity or any sort of factor that makes the pain worse? What makes the pain better? Icing it, not walking, walking, sleeping, resting. Please select if you're experiencing any of these symptoms below: numbness or tingling, instability, ecchymosis, deformity, erythema. Select the best options below. Does your knee pain wake you up from sleep? Do you have difficulty with stairs? Does your knee ever give out on you? Does your knee lock up on you? Do you feel popping in the joint? Do you have difficulty getting in or out of cars? Do you have difficulty putting on shoes or socks? How far are you able to walk? Finish and submit. Please enter all of the information to the best of your ability in the patient health history. Be mindful that each one of these fields needs to have something in it. For example, if you do not have a pain specialist, type in NA. Here, please type in your preferred pharmacy. What is your marital status? What is your employment status? If you are retired, when it asks you to enter your occupation, just put retired. Do you consume alcohol? If yes, how much alcohol do you consume? Please be as thorough as possible. When it asks you about drug use, this is illicit drug use. What about caffeine? How much caffeine? Do you exercise? Do you have any physical activity that you do on a somewhat day-to-day basis? If yes, how much? What is your smoking status? Are you a smoker, former smoker, never smoker? If you've never smoked, input 0. If you're a former smoker or a current smoker, when it asks you how many years, this is how many years that you've smoked. Whether you quit or not, how many years have you smoked cigarettes? Have you used tobacco in the last 30 days? This is any type of tobacco product. Now we're on to the past medical history. These are conditions that are either currently being treated or you've had treated in the past. Please select all that apply. If there were any conditions that weren't listed above, please type here. If there are no other conditions that are listed above, please type in NA. Do you have a history of deep vein thrombosis or pulmonary embolism? Are you taking blood thinners? Even if you are not taking a blood thinner, please type in NA into this box. When the box turns blue, that means that you are able to move forward. Are you presently taking fish oil? Have you ever had general anesthesia? Have you ever had problems in the past with anesthesia? If you've not had problems, please type in NA. Do you have an allergy to latex? Are you currently pregnant? Please list any past hospitalizations and the year. Please list any past surgeries, year, and complications. Please list any allergies and type of reaction. Now we move on to your family medical history. These are your first-degree blood relatives. If you are not aware of any diseases or illnesses, please enter NA. This part is very important. Please list all of your current medications, including supplements and vitamins. Please type in the name of the medication. Press the spacebar to move into the center of the box. Now type the dose, for example, the milligrams of the medication. Then once again, move the spacebar over and type in the frequency. How often do you take this medication? To go down and add another medication, hit the Enter key. Now finish and submit. The next form is the review of symptoms. Although some of these questions may seem redundant, it's important that you answer them all completely and accurately. Please list the reason for today's visit. Is the reason for today's visit the result of an accident? If it is, please explain. If it's not, again, enter NA. Please select any recent diagnostic tests: CT scan, MRI, EMG, X-ray, bone density tests. If you are new to the clinic, we require you to get X-rays. These will be done at Oregon Advanced Imaging. Please select any of the previous treatments: physical therapy, home exercise, cortisone injections, NSAIDs, bracing, narcotic analgesics, heat and/or ice, or activity modification. Have you modified your lifestyle because of your pain? If there's other things you've tried that aren't shown above, select Other and type in here. If you're a new patient and you've not been seen in the clinic in the past 3 years, select the top box. If you're an established patient and you have been seen in the clinic in the last 3 years, select here. Next is the Review of Symptoms section. Please select any that you are currently experiencing. Just a reminder, on the day of your appointment, please remember to bring your photo ID and your insurance cards. Thank you so much for completing these forms, as they are mandatory before your first appointment. Please make sure that the first 3 forms are signed. If they are not signed, we will have to reject them and you'll have to redo them. Thank you so much for submitting these forms, and we here at Advanced Joint Replacement Center hope that you're just excited to meet us as we are to meet you.